Welcome to Let's Talk, the half hour where we join various guests from around our community. Now, let's talk.
Welcome to the program, listeners. Tyler Friel with you on WISR 680 AM 107.5 FM. This is Let's Talk, the half hour where we sit down and chat with various organizations, businesses, nonprofits, and more in our area. And today we welcome back to the show a total healing solution. We are here with Dr. Heather and Dr. Lindsay. Ladies, always good to see you. Welcome back to the show.
Thank you.
Thank you.
Before we dive into everything today, as always, we like to remind our listeners that we are going to be around for the next half hour. So if you have to duck out at any point or leave us after 30 minutes or before 30 minutes or so, we always encourage you to check out the website, WISR680.com. Just look under our programs page. There you'll be able to find today's show with a total healing solution. You're also able to find us on Spotify as well. So if you're a Spotify user, you can locate us there. We're available on your desktop, available on the mobile app as well, or on your smart speaker, anywhere where you can find audio. You can find us here on WISR. But Dr. Heather and Dr. Lindsay, our guest, a total healing solution. Dr. Heather, I will just start with you just to kind of give a general description as to what the mission is of your organization.
My mission is to treat people where they are, treat their root cause, and address their nervous system and whatever problems they're having at that time. So I treat the neuromuscular system. I'm a physical therapist, a dry needling physical therapist, and I'm an herbalist. I offer the ability for your body to heal itself. And anything you come in for, we're going to address your primary concern first.
And then Dr. Lindsay, for you.
Yes, so I'm an osteopathic physician and integrative rheumatologist. My practice is called Rooted Rheumatology, and I treat autoimmune diseases while also looking at the root causes of why the immune system is triggered.
So today we're going to focus a lot on pain and not necessarily the emotional, although one can kind of generally lead to the other. And so, Dr. Heather, I'll start with you. Basically, if a patient were to come in, somebody comes into your office and says, it's my neck, it's my back, whatever that pain issue may be, where do you start with them? How do you start a discovery process?
Well, you'd be surprised. A lot of the pain patterns are very, very similar. And I do get a lot of people, so I actually changed my slogan to Pain Relief Now, because that is who is coming to see me. So people come in, and when you're in pain for any length of time, your nervous system gets involved. And once your nervous system gets involved, then a whole cascading events happen. You start to lose sleep, everything else starts to hurt, and then after 30 to 60 days, you get what's called pain brain, where you have physical changes in your brain and it misinterprets everything as pain, and it puts you in this cycle. And then your nervous system gets stuck in this cycle, which is by sympathetic hyperactivity. And then we have like a whole list of things. So the message I'm sending is treat pain early. So it doesn't lead to anything else. But you come in to see me for neck pain or back pain, I'm going to assess your posture. I'm going to assess some muscles. I'm going to see how you're walking. And we're going to talk about the type of pain. I'm going to treat the vagus nerve. I treat it every session you come in. And then I'm going to see what muscles are in spasm, what muscles are lengthened, what muscles are shortened. And I'm going to treat you where you are, and I'm going to talk to you about things we can do to prevent this issue from getting worse, and things we can do to work on it, improving it while you're at home.
You said vagus nerve. I want to dive into that a little bit more, because you say that's part of every treatment process.
It is.
So what is it? What's its function?
The vagus nerve is a cranial nerve number 10, and it is the longest, at least from the base of the brain. It goes down to your stomach. It affects your heart rate. It affects just everything. It puts you in a state of stress, which is a fight, flight, freeze, and fawn. And if it gets stuck on, then you're stuck in survival mode.
And that means, so if I'm in survival mode, my body is just not doing the things that it's typically used to doing?
It's doing them poorly, because all your energy is going to keep you alive instead of going to like digestion, instead of going to sleep, instead of doing everything you need to do to live in a nice, happy environment. You can chime in.
Sure. So in regards to the vagus nerve, there's different parts of it. There's the primitive part, and then there's the more advanced higher brain part. So what happens to a lot of patients when they're stuck in sympathetic activation, that primitive part of the vagus nerve gets kind of stuck on, and that leads to freeze or fawn state. And they can't function, and that can lead to immune dysregulation.
So freeze or fawn state, if you want to elaborate on that just a little bit.
Sure. So normally sympathetic fight or flight, if you see an acute threat like a a bear or a bobcat, your sympathetic nervous system sends a rush of cortisol. Adrenaline tells you to pick up a weapon, run, get out of it. It keeps you alive. The opposite of sympathetic is parasympathetic, which is rest and digest. And that parasympathetic state's controlled primarily by the vagus nerve. So when the vagus nerve is functioning appropriately in its higher state, you have rest, digest, detoxification, healing. When the sympathetic nervous system takes over, that vagus nerve kind of gets stuck. It's overloaded. It gets stuck in the more primitive state. So you're either freezing or fawning. You're stuck. You don't have energy. Digestion isn't occurring. The bowels get stuck. Multitude of health problems.
It's kind of like you take a car and you got a manual transmission. You're stuck in first gear. You know what? You need to get out. You need to go and do stuff. But your body has spent all of its energy and time on the cortisol rush to save your life, that you can't get to second gear, which is a better gear for running. And, we want to be in third gear for at least, around the town.
Now, this can be in regards to a physical pain. Let's say I injure my neck or whatever it may be. It can start there, and then, as you said, if I go untreated for a while, that's when these complications start to arise?
You know what? So I'm an adoptive mom, and they're finding out that when your child is in utero and the mother has a stressful situation, like my son's birth mom, where she was in high cortisol, she was like fearing for her life, that then affects my son's ability to regulate his cortisol because he was flooded with it in utero. And now they're saying these people from birth are being born with adrenal fatigue because it's been exhausted just trying to survive birth.
So there could be just some people inherently
Yes.
who are in that state. Dr. Lindsay, just on the autoimmune side, well, first of all, if you can just give a description of what autoimmune disorders are, and so people can kind of learn a little bit more about that.
Sure. So let me start by saying I treat a little bit different patient population than what Heather treats. They're coming to her for acute pain. I'm unfortunately seeing patients with chronic pain. They've had prior injuries or they've had structural problems, and there's chronic pain. When a patient is in a state of chronic pain, that stimulates the sympathetic nervous system, gets it stuck on. And if you're constantly in that overwhelmed sympathetic state, the body's not clearing toxins, it's not repairing damaged tissue. For lack of a better term, it's not getting rid of abnormal cells that should no longer be there. And when that cleaning process isn't happening, it leads to an abundance of damaged and dysfunctional cells, which can trigger autoimmune disease. Autoimmune disease just means your immune system isn't working the way it's supposed to. So for example, if you get exposed to a cold or virus, there's a multitude of things that happen with cells such as natural killer cells and T cells. I'm very simplifying it, but these cells
That's still okay.
That's okay. These cells kind of take over, fight off the pathogen, you feel lousy for a few days, and then you get better. If there are damaged cells or cells that have, DNA damage, your body's supposed to clear them and get rid of them. If you are constantly stuck in a state of sympathetic activation from chronic pain and or stress, that clearance doesn't happen and you have damaged cells floating around. Your immune system then gets triggered and thinks those are foreign material, thinks those are like viruses or pathogens, and starts attacking your own tissue.
And so with that, we're going to have a number of side effects or complications.
Exactly. You end up getting autoimmune diseases, things such as lupus, rheumatoid arthritis, psoriatic arthritis, and it's because the immune system is being triggered by cells that should have been cleared but aren't.
Now, does that present itself as a physical pain for some folks?
Absolutely.
Okay.
Absolutely.
And what would that look like? Let's talk about rheumatoid arthritis. What would I start to feel if I'm become symptomatic with that?
Sure. So if a patient has rheumatoid or any other type of autoimmune arthritis, they get joint pains. They may have swelling with it. The presentations vary widely. Some may have involvement of the small joints, such as the fingers and the toes. Others may have involvement of large joints, such as shoulders and hips. But essentially, joint pain, swelling. One of the classic symptoms is morning stiffness or stiffness after immobility. They sit still for a period of time. It's very, very difficult to get up and moving. And then, of course, associated symptoms such as fatigue and malaise. They just feel like they're fighting a flu or an infection all the time.
Now, okay, the age demographic, are these generally some folks that are older, or can it impact anybody?
It can impact anybody, but it tends to affect patients who are older, just because it's harder for the immune system as we get older to clear those abnormal cells. There's a hormonal component too. Inflammatory arthritis likes to affect women right around childbearing age in the early 20s. and then again in the 40s and 50s as they go through menopause. So there's definitely a distribution for women related to hormones. But in terms of age, inflammatory arthritis can affect any age.
Now, when I'm trying to look at my acute pain and chronic pain and decipher when I should get this done, so how do I determine? I'll start with acute pain, Dr. Heather. How do I know I didn't just sleep on my neck wrong and that this might be something a little bit different?
Let me help you out.
Okay.
Pain is pain. Even if you slept on your neck wrong, what happens is, now I was just talking about sleep. So sleep is really interesting. You put your head on your pillow, and if your pillow is not best for you, you end up going into REM sleep, you get sleep paralysis, and then you end up with that huge kink in your neck. Now, that kink can last a day, that can last 2 to 3 weeks, and that can trigger something else to allow a whole cascading effect of other problems, because now you've got that kink in your neck. Now you're bringing your shoulder up because like, oh, it hurts to put my shoulder down. Then you're sitting weird in your chair. Then your hips are thrown out. So pain is a stimulus to tell you that your body is going through change. So you have to recognize what that change is. Like, do I need to go and change my pillow and then it's fixed? Or did I actually cause myself a trigger point, a muscle spasm, because I had something underlying going on through our body?
So I come see you about that. All right.
Yeah.
How do I know? How am I able to
matter.
work through? Well, how am I able to work through it? And like, oh, I have a bad pillow or something like that. You know what I mean?
Okay, so you come in, we talk about this, and then I can see from your posture what's going on. If you're like, you know what, hey, this happens like every month or every 2 weeks, well, then I'm going to tell you get a new pillow. And I'm going to obviously treat the neck. Because it's not just that you slept on that pillow. It's that you had poor posture your whole day. You're on your phone. You're on your computer. Did you have poor posture while you were there? My favorite is watch people driving. They have head forward postures out the wazoo. I don't think half the population could put their shoulders on the back of a chair. And most people don't sit in a chair with their pelvis first. And that is how you correctly sit in a chair. Your pelvis guides your posture and stability. And if you are not treating every day as an opportunity to be in correct alignment, you're not giving yourself any favors.
So there are kind of a lot of things. I know they might turn into acute pain, but maybe things that we're doing over a long span of time that are leading to some of those acute problems then?
Absolutely. It's typically pain is just the straw that broke the camel's back. Your body's able to fix so much on its own. It's a fantastic healer. But sometimes you have that, you've got sympathetic hyperactivity, you're not sleeping, you're not feeling well, and then which one was it? It doesn't matter because now you have pain, and if you don't treat it soon, after 30 days you've moved into the chronic pain. After 60, you've made changes to your brain.
So, Dr. Lindsay, on the autoimmune side, as you go through that evaluation, and maybe just even bouncing off of kind of what Dr. Heather talked about, how some of those long-term issues can become long-term issues on the autoimmune side.
Absolutely. I'd like to chime in first for a second
Absolutely.
on posture. So Dr. Heather mentioned about posture and how important it is. As an osteopathic physician, we learn, structure precedes function, function affects structure. So what that means is, as Heather mentioned, if you're in a stooped posture all the time and your neck is forward, your diaphragm can't expand, you can't breathe properly. If you're not breathing properly with good posture, that can lead to sympathetic stimulation. Also in your neck, you have what's called sympathetic ganglia. There's chains of nerves that turn on the sympathetic nervous system. So if your neck is constantly out of alignment from poor posture, that can lead to sympathetic nervous system overstimulation.
I was going to chime in. So the diaphragm just isn't below your rib cage. You have a pelvic floor diaphragm. So if you are constantly hunched up, we call it tech neck now.
That's what I was gonna ask. Is that
it is tech neck.
Yeah.
But then it's like I look at these kids in school, and all of them have forward pelvis tilts. Not one of them is sitting absolutely correctly in a chair. It's 90-90 pelvis first.
Explain that a little bit more.
So you sit and you put your pelvis down, your knees are at 90, your back is at 90. That is 90-90. You have to think of like what they call my mom called it like the French makeover, like was the immediate posture. So you take the nice deep breath in, you roll the shoulders back, you make sure that your shoulders are over your pelvis are over your knees are over your ankles.
So that's what we are looking for
And
ideal
you'll
posture.
be taller.
So if you're looking to gain a little bit more height, that's what we're looking for as well.
Exactly.
And that's what I was going to ask, and I'll throw this as a jump ball here, but just with the advent of technology, we're on our screens all the time, we're at our computers all the time, maybe we're in chairs more often than we should be. Are all of these things potential ways for us to start to experience pain?
Absolutely. So ever hear the phrase motion is lotion? When you're up and moving, your blood is flowing, circulation is improved. There's also something called lymphatic vessels. Lymphatic vessels are a series of pipes that carry cells to where they're supposed to go and clear toxins away. So if you're not moving, not necessarily exercising, but just not getting enough movement, and you've got tech neck, you're stuck in a chair for hours and hours a day, your circulation is compromised, your lymphatic flow is compromised. Those things both impact immune function.
Go ahead.
You know, what people don't realize is when you exhale, you are exhaling toxins. And so if you are inhibiting your diaphragm from expanding to its fullest, you are now trapping toxins, and that stale air can have so much junk in it. Like, think of like old pneumonia, think of old flu. If it's not exchanging with good air, you're setting yourself up for failure, or a visit with Lindsay.
Unfortunately.
I want to follow up on because just knowing how many of people that I know that work in offices, settings, or are in chairs all day, you know, and it kind of feels like it might be a twofold thing where, all right, I'm starting to hurt, but also this pain, me sitting in a chair all day is kind of preventing me doing the motion type of thing. So what's your message to those of us who are in that setting? What are some of the suggestions you have for office workers?
Well, first off, they're calling the chair like type 3 diabetes, but then they figured out that type 3 diabetes really is inflammation in the brain. So we're going to have to move the chair to type 4 diabetes. And I'm actually giving a lecture on this at NAI for prevention of wellness for their staff, because teachers have tons of these problems. I say get moving. You really, I mean, you shouldn't be sitting like more than 20 minutes, but I know we all have meetings and everything, but absolutely every hour you need to get up. I recommend some really great YouTube channels, like there's Fit by Mick, which has 10-minute workout videos. So you know what? Take a 10-minute break. I mean, if people get cigarette breaks, why don't you get a little exercise break? And then the other thing is you can do sit and be fit. In the nursing home, we do all kinds of hamstring stretches, quad stretches, torso, and do some deep breathing, because if you're not expanding your diaphragm, then you're not having good air exchange. You're not going to be on your A game. You're not going to get enough oxygen to your brain, and then you're going to allow those toxins to stay within your body.
And that kind of gets back to your point of motion is lotion.
Absolutely. And what I advise my patients is everybody just starts somewhere. I feel as a society, we put so much pressure on everybody. You have to be like
jump off the deep end.
Exactly. You have to be a fitness influencer. Start somewhere. Even patients in chronic pain, the simple act of when you're at your desk, just putting a prop under your feet to prop your feet up, that's going to improve circulation. Some patients just need to start there. If patients have the option at work to do a sit-stand desk, that is a good option. If you can, not everybody has that option, but if you do, alternating between sitting and standing, and then of course getting up to take breaks, even if it's just a 5-minute break to walk down the hall, come back, getting up every hour or so to move. That improves circulation. That improves lymphatic.
You just don't want to be sitting at a desk for 8 hours.
Exactly.
And then go home and sit.
Exactly.
Which I'm sure is another thing that falls that a lot of people deal with, is that they're tired when they leave the office and they want to go home. So let me ask what I should be doing if I'm relaxing at home, Dr. Heather. What are some of the techniques? I mean, outside of if I don't want to sit stiff in a chair, or good posture in a chair, and I want to lay back in a recliner, things like this. Is that still okay for me to do?
Well, ask yourself, what majority of your day is spent like that? I mean, are you in a recliner where your pelvis is back in the chair and your back supported? Or are you in a recliner that doesn't really recline? So now you've just shifted those muscles that are going to be tighter. And then, I was going to jump in about hip replacements. So a lot of the population will go and get a hip replacement, and they'll go home and they'll sit in these rigid chairs. They'll do PT for like a month or so, and then it's like they never get out of the chair. So people are coming to me after they've had these issues for years. Their hips we call them hip flexors in the front. They're stuck. They are stuck. Like they stand up and they're forward bent at the waist. And that's another thing. We have to do what's called extensive poses here in the United States. Like when you have a baby and it has tummy time, we need to do that. I cannot tell you how many people over like 30 cannot lie flat on their stomach, cannot roll over in bed, cannot push up, to do a push-up, any kind of push-up, any kind of modification, and then use that to roll over. I mean, seriously, think about it. How many people have a fall and they're like, I couldn't get up. Yeah, we have to do the uncomfortable things. Your body needs to do things that are uncomfortable. Your life is not meant to be absolutely comfortable. Kind of
uncomfortable to get somewhat comfortable.
Yeah.
We're here with Dr. Heather, Dr. Lindsay. We were talking about areas of pain relief. So let's go back to some of these treatment looks. And I know you kind of ran down a list of things that you do, but I want to get into how that looks over a period of time. So if I come to you with whatever it might be, Again, I'll go back to the neck pain just to start there. So if I do that, we do the evaluation process, we start the treatment. How long? I mean, I'm sure that varies on individual cases, but what do I need to know about my treatment timeline?
So, yes, I'd like to say if you're coming in with a significant problem, I'd give it at least a minimum of 4 to 6 visits. Because remember, it's not just your shoulder girdle. Your shoulder attaches to your back attaches to your hips. And most of us are in a seated flexion position and they're stuck. So I have to go and treat all those muscle spasms everywhere. Sometimes they need more than one treatment. But the other dilemma is when I release those toxins, because when I throw a needle in, I force those acetylcholinase into that cell, and it's going to eat up the triggers that were stuck there. Now your body has to process that out. And if you're not breathing well, you're not digesting well, you're not sleeping well, it's going to take longer.
And then Dr. Lindsay, on your side, because I'd imagine with more of these chronic conditions, it could be of a little bit of a different timeline for them.
Yes. So when I am seeing a patient with chronic pain, back, neck, or where the first question, we have to differentiate is how much of this is structural. Is there degenerative wear and tear, arthritis in there? Is something out of alignment? So how much of it is structural? How much of it is inflammatory? Because again, if the immune system isn't clearing toxins and pathogens and infections appropriately, that's going to turn on the sympathetic nervous system and lead to inflammatory type pain. And then also, of course, there is a mental component to pain. If you are in constant pain and you're stiff, it's going to make you feel a little depressed and anxious. If you're depressed and anxious, that's going to lower your pain threshold. So when I see patients, unfortunately, like I said, they're more chronic, I'm teasing out those issues. How much of it is structural? How much of it is inflammatory? How much of it is related to, underlying, I don't want to say mood disorders, but an altered mood because you're depressed and anxious because you're in pain.
And that's what I'm sure it's the same. And I think most people are in that boat that as they're going through whatever painful experience they may be, there's the emotional taxing part of it where, hey, that started with something physical, that physical element's not getting better. Now mentally, I'm struggling with that. Do you find that to be the case with a lot of the folks that you see?
Absolutely. So with a lot of my patients, I sometimes do vagal nerve work and, talk about ways to help process emotions, which helps with pain. If there is a structural component, I do osteopathic manipulation or send them to Heather for dry needling. And a lot of times, if you're addressing the underlying structural component, that helps with pain. But in regards to the emotion, definitely I emphasize sleep, good nutrition with blood sugar balance. Those two simple things, just sleep and glucose control, can really help lower inflammation, can really help how your neurotransmitters in the brain function, and help you deal with, the emotional and inflammatory components to pain.
I also want to just add, because you brought up nutrition there, how important when we're going through whatever issue it may be, is it to really focus on our nutrition and what we're putting into our bodies?
Your body is a temple, treat it as such. Everything you put in, however many ingredients it is, your body has to process it. And your liver, kidneys, skin, and breathing can only expel so much. Those are your mechanisms of waste and detoxifying your body. And if you have a heavy burden, especially if you have tainted water, you're eating processed foods, because processed foods now are not the same like when I was growing up. I talk about the Snickers bar. I think the Snickers bar maybe had 8 to 10 ingredients in it then, and you would eat one and you'd be like, holy cow, I'm full for at least 3 hours. Now these Snickers bars actually have additives in them like BHT, PCPG, that are actually tricking your brain to make you hungrier for them. So you're eating stuff that is stimulating your appetite for other poor things, and it's a vicious cycle.
And that's obviously an area that would be of concern for a lot of folks.
Wait for January.
So as I'm trying to take all these steps to kind of come to a total healing process, what do I need to know as an individual? Because it does seem like there can be a lot of confusing elements to it, that there's a lot of information, there's a lot of resources online, but what would you let a message be to individuals who might be suffering from something?
Sure. So start simple. Sleep and food. Sounds ridiculously simple, but cleaning up the sleep, cleaning up the diet, two most important things you can do for overall general health, let alone for dealing with either acute or chronic pain. Sleep is when your body heals and restores. It's when damaged tissue repairs themselves, and it's when all the toxins and pollutions you were exposed to in a day get cleared. It's also when your immune system heals and repairs, and those cells that shouldn't be there get cleared away. So if you're chronically sleep deprived, that's going to lower your pain threshold, and it's going to set you up for autoimmune disease. In terms of nutrition, like Heather said, our food is abysmal now. I joke around with our children, when we ate junk food, it was just sugar. It wasn't good for you, but it was just sugar. Now there's high fructose corn syrup along with additives, and like Heather said, if you consume those foods, it gets you in a vicious loop for consuming more and more of them. And in our country, as we struggle with an epidemic of obesity, it doesn't just come down to willpower, eat less. Literally, there's additives in food that hijack the hormones. There's ghrelin, which is your hunger hormone, and leptin, which is your satiety hormone or fullness. The hormones are out of balance, and people could literally be starving to death metabolically, but still craving and wanting to eat. And when that's occurring, that can affect inflammation and your ability to process pain.
And then you go back to sleep and you go back to the sympathetic hyperactivity, which throws the cortisol off. So you're either going to dump the cortisol and you're going to spend it all, and then you're not going to have any in your bank for later. But then cortisol regulates all your other hormones. So then you can't get the hormones to be full or to be tired and to sleep.
So I would say, if I was giving patients a message in 5 words, get sleep, eat real food. Sounds ridiculously simple, but those are 2 very important things you can do to calm inflammation and help with pain.
Good areas to start then.
Absolutely.
Yes.
With patients you work with, who are these folks? Because, I'm sure there are some people who, could be repeat customers of yours now, or some folks who are like, well, I've never tried this before. So for maybe somebody out there who hasn't done this, what are some of the things that you hear from them and why they end up coming to see you?
Typically, people come to see me, they're like, I have tried everything else. And I know, I've been there. I've tried everything else with you. But then I get people who come and they've had this and they're like, you know what, I came first. So I'm getting a lot of great referrals from neurologists because people are having not the success they want with surgery, and I'm here to help bridge the gap. So it's like, you had the surgery, now your structures are fine, now your nerves can, they're no longer impinged, but you might still have pain because the nervous system is still stuck in hyperactivity. Or you might have pain because while they fix the bones and the joints, you can't just adjust bones and expect the muscles to all of a sudden magically be where they need to be. You have to tell them, you have to say, all right, you need to lengthen, we need to shorten this. And it takes 6 weeks to get one muscle grade. So you can imagine how long it's going to take after a surgery for the muscle that might have been 4 inches long and is now asking to be 6 inches long because it's the correct alignment. So I'm the gap. So you either have so much pain that you don't want surgery that you come to me and I help you control the pain to avoid surgery, or you had surgery and it's not like the outcome you wanted.
You just need to get over the finish line then.
Yeah, you might have gotten 80% and you're like, hey, it took away X, Y, and Z. That's fantastic. I'll help you get the rest. And I incorporate everything. I use sound, light, everything, like, ultrasound, like microcurrent, all kinds of things. I'm thinking about getting PEMF mats and anything that I can do to put your body in a state of healing to allow your body to heal.
Dr. Lindsay, for you, the patients that you see, and maybe some of the things that they ask you.
Absolutely. So I see patients who have established autoimmune disease, such as known rheumatoid, known lupus. They're in chronic pain with swollen joints. They have inflammation. They want something. They want treatment, but they also want to know, why is my immune system dysfunctional? So I treat those who already have established diagnoses with chronic pain. I also treat patients who are in what we'd refer to as the preclinical state, where they're tired, they're fatigued, they're feeling body aches, but they don't quite yet have a diagnosis of rheumatoid arthritis. And we want to intervene. We want to help optimize the immune system. We want to help optimize health to keep them from getting to that point. I see a lot of patients who have family histories where they look like they're on the spectrum to developing an inflammatory arthritis, but they don't want to get there, obviously, and they want to know what steps they can take. So I do a lot of diet and nutrition counseling. I use supplements. I use osteopathic manipulation, and that's in addition to standard rheumatology disease-modifying drugs.
So if people wanted to reach out, Dr. Heather, I will start with you. What do they need to do?
They need to just call me, 412-282-3826. I have a website, and I offer tons of pain relief options. Like, I have creams, balms, I have tinctures, I have 4 or 5 different plant allies that I can actually formulate to help you.
And again, that phone number, just in case people missed it.
412-282-3826.
And then Dr. Lindsay, for you.
Of course. So Rooted Rheumatology, phone number 412-301-5015, or they can check my website, www.room2look, RHEUM, the number 2, word look, no spaces.com. Give me an email at room2look@gmail.com. Also, I'd like to mention too, if patients do not want a full rheumatology consult, but they want some input on, boundary setting, lifestyle, nutrition optimization, I do offer a number of courses at makeroomforyou.com. Make RHEUM, the number 4 and the letter U.com.
Dr. Heather, Dr. Lindsay, ladies, thanks so much for the time.
Thank you, sir.
Thank you.
Hey, if you missed any of our program, as always, you can find it online, WISR680.com. We're also available on Spotify as well. You've been listening to Let's Talk here on WISR.